we go to discussions later, we will have the next speaker. The next speaker is Ms. Yeong Yi Yim from the Department of Healthcare Services Innovation in the Korean Health Industry Development Institute, will present on digital healthcare policy and digital New Deal in Korea. Unfortunately, Yeong Yi Yim will not be able to be with us live tonight, so we have pre-recorded a session that we will be shown now, and that will be the input, second input from Korean side. So let's hear what Yeong Yi Yim has to say. Thank you.
Hello, I am Yeong Yi Yim from Korea Health Industry Development Institute. As the current global spread of COVID-19 results in restricted physical movements at home and abroad, the traditional face-to-face lifestyle is shifting toward an unchecked one. This new paradigm is not an exception in the medical services area as well. Accordingly, there is increasing demand for expansion of unchecked medical services, and the digital healthcare market is also expected to grow continuously. In this context today, I would like to talk about the current status of the digital healthcare policy and digital healthcare New Deal in Korea. This presentation will be given in 4 different parts, starting from a brief introduction of KHIDI, which is my company, Korea Health Industry Development Institute, followed by the necessity for digital healthcare in Korea, the pursued direction of digital healthcare policy, and finally, major digital healthcare projects in Korea. Introduction of KHIDI. KHIDI is a government agency under the umbrella of the Ministry of Health and Welfare of Korea, located in Osong Health Technology Administration Complex with Korea Disease Control and Prevention Agency, Ministry of Food and Drug Safety, and National Institute of Health. KHIDI is established in 1999 in order to raise international competitiveness in the healthcare industry and improve public health by professionally and systematically undertaking projects to nurture and develop the healthcare industry and enhance health services that can respond to internal and external environmental changes. Strategic objectives are as shown. First, to develop a public health-oriented healthcare industry. And second, to enhance global competitiveness of the healthcare industry. Third, to create an innovative growth ecology for the healthcare industry. And lastly, to establish a social value-based management system. Now, let me explain why digital healthcare should be introduced in Korea. The biggest reason that justifies the introduction of digital healthcare is the aging of the society. Population aging is accelerating worldwide, and the growing number of patients with chronic disease is increasing medical expenses. In particular, as the rapid growth in medical expenses of the super-aged population at 65 or older is emerging as a big social issue, countries around the world strive to find solutions to solve this issue. As you can see, national healthcare expenditure of Korea is 8.1%, which was lower than the OECD average, but the rapid increase emerged as a social issue. The healthcare expenditure increase rate from 2005 to 2015 is 6.8%, which is the highest among OECD members. There is also a growing need for improved medical security for medically disadvantaged classes, including citizens in medically disadvantaged areas and persons with disabilities, and a need to resolve health inequity between social classes. Various countries in the world experience rapid urbanization, and Korea also went through the urbanization at a rapid speed. A rapid change into urbanization widens a gap in medical resources, causing problems in access to medical services. There is also growing interest in improving efficiency and safety of medical services with the development of ICT-based medical technologies. To achieve ultimate health and equity, we need to pay attention to quality, accessibility, and sustainability. Next, I will introduce Korea's main policies on digital healthcare. In Korea, 3 data acts were revised, which include clear standards for the identification, as well as the identified information available for the consolidation of statistics and conduct of studies, and clearer criteria for identifying vague personal data. Other things are gradual extension of telemedicine coverage. In 2019, comprehensive negative regulation was implied. This is to facilitate and release innovative products to the market. Also, the process of approval and permission of digital healthcare products were simplified, especially medical devices. Third, Korea designated 7 areas as regulation-free special zones. This is for rapid testing and implying innovative technology and development of new projects. Each area focuses on digital healthcare, smart wellness, smart safety, blockchain, e-mobility, autonomous driving, and next-generation battery recycling. Now, I will introduce biohealth industry innovation strategies launched in 2019. First, the government plans to establish big data of 1 million persons by 2029 and collect gene information, medical service history, and health status from those who agree to provide such information and utilize it in developing tailored new drugs and new medical technologies. Second, the government designated data-centered hospitals in order to actively utilize vast amounts of clinical data being accumulated in hospitals in studying disease and developing new drugs. Third, support for access to the market. This is to facilitate new technology use, including digital healthcare devices. This slide shows current state of R&D investment in the digital healthcare sector in Korea. R&D investment mainly focuses on AI, biosensor, gene technology, cloud, and robotics. On this part, I will introduce major digital healthcare projects implemented in Korea. This slide explains the EMR certification system project. It aims to standardize EMR systems used by hospitals to ensure patient stabilization and treatment continuity, and also to promote the use of standard data. To introduce this system, the government crafted a certification system plan in 2017 and operated a pilot project with 8 domestic hospitals from August 2018. Based on the results of the project, the Ministry of Health and Welfare issued notification of operation of EMR certification system in 2020. It includes 3 criteria, which are functionality, interoperability, and security. The next project I would like to introduce to you is a project for healthcare information exchange. The goal of this project is to prevent wrong diagnosis, such as causing a drug accident by not checking the patient's medical records, and also to improve the inconvenience of patients having to receive and submit their medical records in paper or CD format whenever they move to a new hospital. Back in 2016, Korea established legal grounds by amending the health insurance scheme to allow hospitals to electronically transmit medical records to each other under patient's consent, and also build and operate required information systems. As of 2018, a total of 2,316 hospitals and clinics, including 15 major general hospitals, which are teaching hospitals, were engaged in this project. Then, in 2019, 15 hub hospitals and 1,416 affiliated hospitals and clinics were added to the project, complementing a nationwide network. This one is the National AI Strategy. The goal is to expand the AI infrastructure, including making public data available for more high-quality data, and especially to build new drug development platforms, support data-centered hospitals, and build a framework for clinical validation sample data, and review for AI-based medical devices. This strategy also includes the Dr. Answer project, where 26 hospitals and 22 businesses work together to develop healthcare AI for 8 key diseases. With the recent COVID-19 crisis, the government announced a New Deal policy in July, and one of its 10 projects is to build smart medical infrastructure, which includes building a diagnosis system using AI-based Dr. Answer. The next is Smart Hospital. This also started as one of the Healthcare Digital New Deal in July 2020. Basically, the concept is a hospital and smart healthcare system adopting digital technologies, for example, 5G, AI, IoT, and so on. It aims to provide quality of care by effective integration and pursuit of various services for patients through cooperation and adjustment among suppliers. Smart Hospital is equipped by diverse digital technologies based on medical information, provided by efficient and effective core services for the existing serious disease, emergency acute periods, and surgeries. It also shares and connects data among service providers through medical data platforms within areas. The plans include, first, establishment of 9 smart hospital models and pursuit of a base for AI diagnosis on 8 diseases until 2020. Second, expansion of the number of hospitals to 18, and pursuit of increase in the number of AI diagnosable disease until 2025. Third, pursuit of real-time monitoring on hospitalized patients through real-time transfer of and management on video information on patients in isolated wards and intensive care units, and of digitalization of medical institutions in terms of digital pathology within hospitals. Fourth, support for realization of primary and secondary smart medical institutions, expansion of connectivity among the regional medical institutions, and enhancement of healthcare management services based on improved consumer value. This is the end of my presentation. The world is facing an unprecedented crisis due to COVID-19 pandemic. I hope all of you can wisely overcome this crisis. Thank you for listening.